Hello, my name is Joel Straz, Health Officer with the Bay County Health Department, and today is Thursday, August 12th, and here's the update for COVID-19 and the status of the COVID vaccine here in Bay County, Michigan. Two months ago, in our last video, the test positivity rate was 2.2%, and we subsequently enjoyed 2 months of low cases and relative calm with the virus. However, today, our test positivity rate in the county is 9.3%, and in the last 2 weeks, the number of cases has remarkably increased, and unfortunately, we are a community, like many others around the state and in the country, in substantial transmission of the virus. This is primarily due to the Delta variant, and today we will discuss what the variant is, its features, and its threat to our community recovering. But we will also discuss what we can do to get past this latest obstacle. The Delta variant is now spreading rapidly throughout the world, and it is the dominant strain of COVID-19 in the state of Michigan and Bay County. It is much more transmissible than the original strain of the virus and carries a higher viral load, up to 4 to 6 times higher, as measured in some studies. With this increased viral load, unvaccinated persons are more susceptible to the virus, and it seems that it can cause more severe illness and hospitalizations. You have heard in some areas of the southern United States that hospitalizations have spiked, and a striking feature of the current outbreak is that it seems to be affecting children at a higher rate than in past outbreaks of the pandemic. There are also a small but growing number of what is called breakthrough cases amongst vaccinated persons. This is not unusual, as no vaccine can totally prevent infection. In fact, our current estimates in Bay County reveal only about 120 of the 54,000 fully vaccinated persons have been infected post-vaccination. The overwhelming majority of these infections are mild and do not require hospitalization, so the vaccines work. But the variant is troublesome, especially for those who are unvaccinated, and especially as the new school year is set to begin. First, as CDC recommends, we need to employ the protective measures that we have been using for the past 18 months and put them back into place. That means staying home when we are sick and making sure that we are not spreading the virus in crowded public settings, masking in public places, utilizing good ventilation at home, at school, and at work, getting tested if we are symptomatic or exposed to a confirmed positive case, and finally, and most importantly, getting vaccinated. If you want to avoid the unnecessary cost and suffering due to the virus, I ask you to get vaccinated as soon as you possibly can, if you haven't done so already. If you want to have your children attend school without interruption of illness or quarantines, please get yourself and children, if they are eligible, vaccinated if you haven't done so already. Communities with lower vaccination rates have seen a greater proportion of children and adolescents with more severe illness from the virus, so please take that into consideration. Finally, you may ask, how long will the Delta variant surge last in our community? If it's like past surges, they typically run high for a period of 6 to 10 weeks. In the United Kingdom and India, Delta surges have lasted as long, with steep rises and then steep declines. But the difference between the two is that in India, where vaccination rates are particularly low, the number of severe cases, hospitalizations, and death were much higher than in the United Kingdom. So once again, please do your part. Protect yourself and your family and get vaccinated today.